Good evening. To follow on patient information when they know they have cancer. Number one, a patient, once they diagnosed of cancer, they should not panic. They should sit with their cancer specialist. They need to hear options of their treatment, whether it is surgical treatment, radiation treatment, or chemotherapy treatment, or combination of the above. They need to meet with each discipline to understand pros and cons of each treatment. Then they need to decide the treatment which suit them the most. It's very important that they need to hear each discipline from the specialist. If it is surgical treatment, they need to hear pros and cons of surgical treatment from the surgeon. If it is radiation treatment, they need to hear pros and cons of radiation treatment from their surgeon, from their radiation oncologist. If it's chemotherapy treatment, they need to hear pros and cons of chemotherapy treatment from the chemotherapy physician. Once patient decide treatment suit them the most, they need to be committed to such treatment. For example, if patient committed to radiation treatment, they need, number one, to understand potential side effects during the treatment. Number two, they need to understand they should not interrupt the treatment without talking to their cancer specialist, in this case their radiation doctor. They need to follow up very closely and understand potential side effects, what aggravates side effects, and so on. For surgical treatment, same thing, and for chemotherapy, same thing. It's very important for each patient to understand expected potential side effects, even if they would not occur. For example, patient will go for radiation treatment to their prostate. The chance they get diarrhea is very small, but we tell them, the patient, you might get diarrhea, then patient is prepared, and so on. Same thing if they will go for surgery, they need to understand there is possibility the wound would not heal, and so on, even though majority of patients wound heals. If they will go for chemotherapy, they need to understand they gonna lose their hair, even though many chemotherapy agents would not lead to hair loss. It's so important for patients to understand benefits versus side effects of each treatment. Then they are prepared. Number two, they need to be fully committed to the treatment. Radiation treatment is daily treatment, Monday through Friday, for 6 to 8 weeks, and sometimes twice a day. Patients need to understand they should not interrupt the treatment. Interruption of the treatment lead to decrease in control of the tumor, so the chance of cure will be less. So if they have to interrupt the treatment like we do during the holidays, Christmas, New Year, for certain cancer, sometimes we compensate by giving the patient twice a day before the holiday or after the holiday, so that the whole treatment duration is the same. That's true in certain cancers, and is true in other cancers. If you interrupt 1 week or two is probably okay. So you need to be very close to your doctor, and if you have to interrupt, many times patients booked flight to go for a week, and in some cancers like colorectal cancer, sometimes that's okay, sometimes also okay in prostate cancers and other cancers. For some cancers, sometimes it's so difficult and is not wise to interrupt the treatment, for example in head and neck cancer. For those patients who have head and neck cancers and they need interruption, a compensatory treatment need to be done, so the total treatment will be in the same duration and patient tumor control will not be compromised. So number one, understand your cancer potential options of treatment. Number two, potential side effects and potential benefits. Number four, your compliance. Patient compliance is so important and play a major role in cancer treatment. I recall few patients who were non-compliant and their tumor tripled in size, and because they don't come for treatment, they take few weeks. They said, oh, I'm tired, I don't want to do the treatment today, I want to take 2 weeks off, and so on and so on. If you do that during radiation treatment or any treatment, that will compromise your chance of cure. As a matter of fact, the tumor could grow and could result in spread of cancer, and no bad news we will know for those patients who are not compliant with their treatment. So once patient being compliant, then how they cope with the side effects, they need to predict what side effects, how could we alleviate it. For example, patients during radiation treatment to skin, they need to avoid sun exposure, they need to avoid washing their skin with hot water, they need to avoid rubbing in that area, and so on. If you avoid those things that cause side effects, then side effects would be way less. So avoid skin irritant, sun, hot water, rubbing, and so on. Number two, take your medications. If the skin is slightly reddish, then we usually give our patients special creams. For example, hydrocortisone creams. Patients could put it on the skin and it would be good, no side effects. Or patients, for example, eat spicy food and we treat them the pelvic, they get sore rectum, they feel soreness when they have bowel movement. We tell the patient, do not eat any spice food during your radiation treatment. Those patients who stop spicy food, this discomfort or pain usually disappear. So understanding or expecting side effects, so you could modulate your lifestyle and do preventive measures to minimize the occurrence of side effects. Patients who could get diarrhea, we tell them to take special food, avoid bulky food because that would enhance diarrhea, and so on. So understanding side effects and do preventive measures at the level of the area would be exposed to potential side effects, that would help greatly in decreasing the side effects of your treatment. So understanding what type of cancer, what stage, treatment options, what expected side effects, measures to prevent these side effects, not to stay in the sun for skin, not to eat spicy, and so on. All these factors help to make your treatment smooth and your outcome, God willing, is good.